1. What is the mechanism of action of beta blockers? A. Blocks calcium channels. B. Inhibits angiotensin-converting enzyme. C. Blocks beta-adrenergic receptors, reducing heart rate. D. Stimulates adrenergic receptors. Answer: C. Blocks beta-adrenergic receptors, reducing heart rate. Rationale: beta blockers work by blocking beta-adrenergic receptors, leading to decreased heart rate and reduced myocardial oxygen demand. Option A refers to calcium channel blockers. Option B describes ACE inhibitors, and Option D is incorrect because beta blockers block rather than stimulate adrenergic receptors. 2. Which antibiotic is commonly associated with ototoxicity and nephrotoxicity? A. Azithromycin. B. Amoxicillin. C. Gentamicin. D. Doxycycline. Answer: C. Gentamicin. Rationale: aminoglycosides like gentamicin are known for their potential nephrotoxicity, kidney damage, and ototoxicity, hearing loss. Azithromycin, A, and doxycycline, D, are less likely to cause these adverse effects, while amoxicillin, B, is generally well tolerated. 3. A nurse is administering warfarin to a patient. Which lab value should be closely monitored? A. Hemoglobin. B. International Normalized Ratio, INR. C. Sodium levels. D. Platelet count. Answer: B. International Normalized Ratio, INR. Rationale: warfarin is an anticoagulant, and INR is the key lab value used to monitor therapeutic levels. Hemoglobin A and platelet count, D, are relevant for assessing overall blood health, but are not the primary values monitored for warfarin therapy. Sodium, C, is unrelated. 4. Which medication should be avoided in children due to the risk of Reye's syndrome? A. Acetaminophen. B. Aspirin. C. Ibuprofen. D. Diphenhydramine. Answer: B. Aspirin. Rationale: aspirin should not be given to children, especially during viral infections, due to the risk of Reye's syndrome, a rare but serious condition that affects the liver and brain. Acetaminophen, A, and ibuprofen, C, are safer alternatives, while diphenhydramine, D, is an antihistamine not linked to Reye's syndrome. 5. A patient is receiving an opioid for pain management. Which adverse effect requires immediate intervention? A. Constipation. B. Nausea. C. Respiratory depression. D. Drowsiness. Answer: C. Respiratory depression. Rationale: respiratory depression is the most life-threatening side effect of opioids and requires immediate intervention. Constipation, A, nausea, B, and drowsiness, D, are common but less critical side effects. 6. Which of the following medications is classified as a loop diuretic? A. Spironolactone. B. Hydrochlorothiazide. C. Furosemide. D. Mannitol. Answer: C. Furosemide. Rationale: furosemide is a loop diuretic that inhibits sodium and chloride reabsorption in the loop of Henle. Spironolactone, A, is a potassium-sparing diuretic, hydrochlorothiazide, B, is a thiazide diuretic, and mannitol, D, is an osmotic diuretic. 7. A patient taking digoxin is experiencing nausea, vomiting, and visual disturbances. What should the nurse do first? A. Administer an antiemetic. B. Assess the patient's potassium level. C. Hold the next dose and check digoxin levels. D. Encourage fluid intake. Answer: C. Hold the next dose and check digoxin levels. Rationale: signs of digoxin toxicity include nausea, vomiting, and visual disturbances, e.g., halos around lights. The next dose should be held, and serum digoxin levels checked. Potassium levels, B, should also be monitored, but the priority is to prevent further toxicity. 8. Which medication is used as an antidote for opioid overdose? A. Flumazenol.
B. Naloxone.
C. Atropine. D. Protamine sulfate. Answer: B. Naloxone. Rationale: naloxone is an opioid antagonist used to reverse opioid overdose. Flumazenol, A, reverses benzodiazepines. Atropine, C, is used for bradycardia, and protamine sulfate, D. Reverses heparin. 9. Which adverse effect is commonly associated with ACE inhibitors? A. Hypokalemia. B. Dry cough. C. Bradycardia. D. Weight gain. Answer: B. Dry cough. Rationale: ACE inhibitors like lisinopril can cause a persistent dry cough due to increased bradykinin levels. Hypokalemia, A, is not common. ACE inhibitors may cause hyperkalemia. Bradycardia, C, is more associated with beta blockers, and weight gain, D, is not a typical side effect. 10. Which anticoagulant requires routine monitoring of INR? A. Heparin. B. Warfarin. C. Enoxaparin. D. Rivaroxaban. Answer: B. Warfarin. Rationale: warfarin requires INR monitoring to ensure therapeutic anticoagulation. Heparin, A, is monitored using APTT, while enoxaparin, C, and rivaroxaban, D, do not require routine INR monitoring. 11. A nurse should teach a patient taking levothyroxine to take the medication. A. With meals to prevent stomach upset. B. At bedtime for best absorption. C. On an empty stomach in the morning. D. With calcium supplements to enhance absorption. Answer: C. On an empty stomach in the morning. Rationale: levothyroxine is best absorbed on an empty stomach in the morning, at least 30 to 60 minutes before food. Calcium supplements, D, should be avoided close to administration as they impair absorption. 12. Which of the following insulins is long-acting? A. Lispro. B. Aspart. C. NPH. D. Glargine. Answer: D. Glargine. Rationale: Glargine is a long-acting insulin providing steady blood sugar control for 24 hours. Lispro, A, and Aspart, B, are rapid-acting, and NPH-C is intermediate-acting. 13. A patient is prescribed albuterol. What is the primary expected effect? A. Reduced inflammation in the lungs. B. Bronchodilation. C. Decreased mucus production. D. Suppression of the immune system. Answer: B. Bronchodilation. Rationale: albuterol is a short-acting beta agonist, SABA, that relaxes bronchial smooth muscles to relieve bronchospasms. It does not reduce inflammation, A, decrease mucus, C, or suppress immunity, D. 14. What is a major adverse effect of statins? A. Hypoglycemia. B. Rhabdomyolysis. C. Bradycardia. D. Hypokalemia. Answer: B. Rhabdomyolysis. Rationale: statins can cause rhabdomyolysis, a serious condition that leads to muscle breakdown and potential kidney damage. Hypoglycemia, A, is more related to diabetes medications. Bradycardia, C, is linked to beta blockers, and hypokalemia, D, is not a common effect. 15. What should the nurse monitor when administering for furosemide? A. Blood glucose levels. B. Potassium levels. C. Liver enzymes. D. White blood cell count. Answer: B. Potassium levels. Rationale: furosemide is a loop diuretic that can cause hypokalemia, low potassium. Blood glucose, A, and liver enzymes, C, are not directly affected. 16. What is the mechanism of action of proton pump inhibitors, PPIs? A. Neutralizes stomach acid. B. Blocks histamine 2 receptors in the stomach. C. Inhibits the hydrogen/potassium ADPase enzyme. D. Increases mucus secretion in the stomach lining. Answer: C. Inhibits the hydrogen/potassium ADPase enzyme. Rationale: PPIs like omeprazole inhibit the hydrogen/potassium ADPase enzyme in gastric parietal cells, reducing acid secretion. Antacids, A, neutralize acid, H2 blockers, B, block histamine receptors and mucus secretion, D, is enhanced by cytoprotective agents like misoprostol. 17. Which medication is most appropriate for treating an acute asthma attack? A. Salmeterol. B. Albuterol. C. Montelukast. D. Ipratropium. Answer: B. Albuterol. Rationale: albuterol is a short-acting beta agonist, SABA, used for acute asthma attacks. Salmeterol, A, is long-acting, montelukast, C, is for prevention, and ipratropium, D, is an anticholinergic that is not the first-line choice for acute attacks. 18. What is a key side effect of opioid analgesics? A, diarrhea. B, respiratory depression. C, hypertension. D, increased urinary output. Answer: B, respiratory depression. Rationale: opioids like morphine can cause respiratory depression, a serious adverse effect. They typically cause constipation, not diarrhea, hypotension, not hypertension, and urinary retention, not increased output. 19. What is the primary action of metformin? A, stimulates insulin secretion. B, increases insulin sensitivity and decreases hepatic glucose production. C, blocks carbohydrate absorption in the intestine. D, inhibits pancreatic beta cell function. Answer: B, increases insulin sensitivity and decreases hepatic glucose production. Rationale: metformin, a first-line treatment for type 2 diabetes, improves insulin sensitivity and decreases glucose production by the liver. It does not stimulate insulin secretion, A, block carbohydrate absorption, C, or inhibit beta cell function, D. 20. Which electrolyte abnormality is a major concern with furosemide use? A, hyperkalemia. B, hypokalemia. C, hypercalcemia. D, hypernatremia. Answer: B, hypokalemia. Rationale: furosemide, a loop diuretic, promotes potassium excretion, leading to hypokalemia. It does not typically cause hyperkalemia, A, hypercalcemia, C, or hypernatremia, D. 21. Which antibiotic class is associated with tendon rupture as a serious adverse effect? A, penicillins.
B, cephalosporins.
C, fluoroquinolones. D, macrolides. Answer: C, fluoroquinolones. Rationale: fluoroquinolones like ciprofloxacin can cause tendon rupture, especially in older adults and those on corticosteroids. Penicillins, A, cephalosporins, B, and macrolides, D, do not carry this risk. 22. What should a nurse monitor when administering vancomycin for? A, liver enzymes. B, red blood cell count. C, creatinine and BUN. D, platelet levels. Answer: C, creatinine and BUN. Rationale: vancomycin can cause nephrotoxicity, so kidney function, BUN and creatinine, should be monitored. It is not primarily hepatotoxic, A, does not significantly affect RBCs, B, and does not usually impact platelets, D. 23. A patient is prescribed nitroglycerin for angina. Which instruction should the nurse provide? A, take on an empty stomach to enhance absorption. B, swallow the tablet whole with water. C, sit down before taking the medication to prevent dizziness. D, if chest pain persists after the first dose, wait 30 minutes before taking another. Answer: C, sit down before taking the medication to prevent dizziness. Rationale: nitroglycerin can cause hypotension and dizziness, so patients should sit or lie down when taking it. It is placed under the tongue, not swallowed, and additional doses can be taken every 5 minutes up to 3 times, not 30 minutes apart. 24. What is an expected side effect of albuterol? A, bradycardia. B, tremors. C, drowsiness. D, constipation. Answer: B, tremors. Rationale: albuterol, a beta agonist, can cause tremors due to its stimulatory effect on beta receptors. It may also cause tachycardia, not bradycardia, A. It does not induce drowsiness, C, or constipation, D. 25. Which of the following medications requires frequent INR monitoring? A, dabigatran. B, rivaroxaban. C, warfarin. D, enoxaparin. Answer: C, warfarin. Rationale: warfarin requires INR monitoring to maintain therapeutic anticoagulation. Dabigatran, A, rivaroxaban, B, and enoxaparin, D, do not require routine INR checks. 26. Which medication is used to treat opioid-induced constipation? A, docusate sodium. B, naloxegol. C. Omeprazole. D. Diphenoxylate. Answer: B. Naloxegol. Rationale: naloxegol is a peripherally acting opioid antagonist used to treat opioid-induced constipation. Docusate sodium, A, is a stool softener. Omeprazole, C, treats GERD, and diphenoxylate, D, is an antidiarrheal. 27. What is the antidote for benzodiazepine overdose? A. Naloxone. B. Flumazenol. C. Protamine sulfate. D. Atropine. Answer: B. Flumazenol. Rationale: flumazenol is a benzodiazepine antagonist. Naloxone, A, reverses opioids. Protamine sulfate, C, reverses heparin and atropine. D, treats bradycardia. 28. Which class of drugs is contraindicated in pregnancy due to fetal abnormalities? A. ACE inhibitors. B. Beta blockers. C. Antacids. D. Penicillins. Answer: A. ACE inhibitors. Rationale: ACE inhibitors can cause fetal renal damage and are contraindicated in pregnancy. Beta blockers, B, may be used with caution, and antacids, C, and penicillins, D, are generally safe. 29. A patient taking lithium should be monitored for which electrolyte imbalance? A. Hyperkalemia. B. Hyponatremia. C. Hypocalcemia. D. Hypernatremia. Answer: B. Hyponatremia. Rationale: lithium clearance is affected by sodium levels, and hyponatremia increases toxicity risk. Hyperkalemia, A, and hypocalcemia, C, are not typically linked to lithium use. 30. What is the primary action of naloxone? A. Stimulates opioid receptors. B. Blocks opioid receptors. C. Enhances opioid metabolism. D. Increases opioid absorption. Answer: B. Blocks opioid receptors. Rationale: naloxone is an opioid antagonist that reverses opioid effects by blocking receptors. It does not stimulate A. Metabolize C, or increase absorption D, of opioids. 31. Which medication is used as an antidote for heparin overdose? A. Vitamin K. B. Protamine sulfate. C. Fresh frozen plasma. D. Deferoxamine. Answer: B. Protamine sulfate. Rationale: protamine sulfate neutralizes heparin's effects. Vitamin K, A, is used for warfarin reversal. Fresh frozen plasma, C, contains clotting factors, and deferoxamine, D, is for iron toxicity. 32. What is a common side effect of ACE inhibitors? A. Dry cough. B. Bradycardia. C. Hypoglycemia. D. Constipation. Answer: A. Dry cough. Rationale: ACE inhibitors, e.g., lisinopril, commonly cause a persistent dry cough due to bradykinin buildup. They may cause hyperkalemia, but not bradycardia, B, hypoglycemia, C, or constipation, D. 33. Which class of drugs is first line for treating heart failure? A. Calcium channel blockers. B. ACE inhibitors. C. Beta blockers. D. Loop diuretics. Answer: B. ACE inhibitors. Rationale: ACE inhibitors reduce afterload and prevent cardiac remodeling, making them first line for heart failure. Beta blockers, C, and loop diuretics, D, are used adjunctively, while calcium channel blockers, A, are not first line. 34. What is the primary use of methotrexate in cancer treatment? A. Inhibits folic acid metabolism. B. Enhances DNA replication. C. Stimulates cell division. D. Increases white blood cell production. Answer: A. Inhibits folic acid metabolism. Rationale: methotrexate is a folate antagonist that inhibits cell division in cancer cells. It does not enhance DNA replication, B, stimulate cell division, C, or increase WBCs, D. 35. A patient taking digoxin is at risk for which toxicity symptom? A. Blurred vision with yellow halos. B. Hypertension. C. Hyperkalemia. D. Dry mouth. Answer: A. Blurred vision with yellow halos. Rationale: digoxin toxicity can cause yellow-tinged vision, nausea, and arrhythmias. It is associated with bradycardia, not hypertension, B, and hypokalemia, not hyperkalemia, C. 36. What is the main adverse effect of long-term corticosteroid therapy? A. Hypoglycemia. B. Osteoporosis. C. Hypotension. D. Weight loss. Answer: B. Osteoporosis. Rationale: long-term corticosteroid use leads to bone loss, hyperglycemia, not hypoglycemia, hypertension, not hypotension, and weight gain, not loss. 37. Which medication should be avoided in children due to the risk of Reye's syndrome? A. Acetaminophen. B. Aspirin. C. Ibuprofen. D. Naproxen. Answer: B. Aspirin. Rationale: aspirin is linked to Reye's syndrome in children with viral infections. Acetaminophen, A, and ibuprofen, C, are safer alternatives. 38. A nurse should monitor for what when a patient is on spironolactone? A. Hyperkalemia. B. Hypocalcemia. C. Hypernatremia. D. Hypokalemia. Answer: A. Hyperkalemia. Rationale: spironolactone is a potassium-sparing diuretic, increasing potassium levels. It does not cause hypokalemia, D, hypocalcemia, B, or hypernatremia, C. 39. Which drug is an anticoagulant that does not require routine INR monitoring? A. Warfarin. B. Heparin. C. Rivaroxaban. D. Enoxaparin. Answer: C. Rivaroxaban. Rationale: rivaroxaban is a direct oral anticoagulant that does not require INR checks. Warfarin, A, requires monitoring, while heparin, B, and enoxaparin, D, are monitored via APTT. 40. What is a serious adverse effect of aminoglycosides like gentamicin? A. Hepatotoxicity. B. Ototoxicity. C. Hyperglycemia. D. Hypertension. Answer: B. Ototoxicity. Rationale: aminoglycosides can cause ototoxicity and nephrotoxicity. They do not cause hepatotoxicity, A, hyperglycemia, C, or hypertension, D. 41. A nurse should teach patients on levothyroxine to take it: A, with food. B,
At bedtime.
C, on an empty stomach. D, with milk. Answer: C, on an empty stomach. Rationale: levothyroxine is best absorbed on an empty stomach, usually in the morning before eating. Food, milk, and nighttime dosing reduce its effectiveness. 42. What is a common side effect of phenytoin? A. Hypotension. B. Gingival hyperplasia. C. Hypoglycemia. D. Insomnia. Answer: B. Gingival hyperplasia. Rationale: phenytoin can cause gum overgrowth, requiring good oral hygiene. It does not commonly cause hypotension, hypoglycemia, or insomnia. 43. What is a contraindication for beta blockers? A. Diabetes. B. Asthma. C. Hypertension. D. Anxiety. Answer: B. Asthma. Rationale: beta blockers can cause bronchoconstriction and should be avoided in asthma patients. They can be used in diabetes, A, and hypertension, C. 44. Which electrolyte imbalance is associated with lithium toxicity? A. Hyponatremia. B. Hyperkalemia. C. Hypomagnesemia. D. Hypocalcemia. Answer: A. Hyponatremia. Rationale: low sodium increases lithium toxicity risk. Hyperkalemia, hypomagnesemia, and hypocalcemia are not primary concerns. 45. What is the first-line drug for status epilepticus? A. Phenytoin. B. Diazepam. C. Carbamazepine. D. Lamotrigine. Answer: B. Diazepam. Rationale: diazepam or lorazepam is used first for status epilepticus. Phenytoin, A, is used for maintenance, while carbamazepine, C, and lamotrigine, D, are not first-line for acute seizures. 46. What is the major side effect of clozapine? A. Agranulocytosis. B. Hypertension. C. Hyperglycemia. D. Weight loss. Answer: A. Agranulocytosis. Rationale: Clozapine can cause severe neutropenia, agranulocytosis, requiring frequent blood monitoring. 47. What should be avoided with MAOIs like phenelzyme? A. Dairy. B. Tyramine-rich foods. C. Leafy greens. D. High-fiber foods. Answer. B. Tyramine-rich foods. Rationale: tyramine-rich foods, cheese, wine, aged meats, can cause hypertensive crises with MAOIs. 48. Which medication can cause serotonin syndrome if combined with SSRIs? A. Acetaminophen. B. Tramadol. C. Metformin. D. Omeprazole. Answer. B. Tramadol. Rationale: tramadol increases serotonin levels, increasing serotonin syndrome risk with SSRIs. 49. What is the first-line drug for anaphylaxis? A. Diphenhydramine. B. Epinephrine. C. Prednisone. D. Albuterol. Answer. B. Epinephrine. Rationale: epinephrine is the first-line treatment for anaphylaxis. Antihistamines and steroids are adjunctive. 50. Which class of medications can cause hypoglycemia? A. Beta blockers. B. ACE inhibitors. C. Insulin. D. Calcium channel blockers. Answer. C. Insulin. Rationale: insulin lowers blood sugar and can cause hypoglycemia. Beta blockers can mask symptoms but do not cause it.